Did you know that there are better breast cancer cure rates reported in some countries? How was this achieved? Join Just Medicine as we scour world medical literature to discover how better breast cancer cure rates were achieved after surgical treatment. In each video of this series, we discuss 3 different countries, so stay tuned to find out if we will be exploring yours in this one. Are you ready to discover a new world that is dedicated to better breast cancer cure rates through better surgical treatment options? If you are, let us begin. In a prior series of videos, we have discussed how and why the National Institute of Health published this consensus statement in 1991. The list of videos is provided in the description below. For now, we will focus on the fact that this professional medical body back in 1991 stated that breast conservation treatment is preferable to mastectomy because it provides survival rates equivalent to those of total mastectomy while preserving the breast. It was therefore extremely perplexing that more than a decade after robust scientific evidence showed equivalent survival with breast conservation treatment or lumpectomy, there was a decrease in its utilization, which continues for many years after. Fortunately for women newly diagnosed with breast cancer, there are doctors who continue their tireless work to seek better cure rates for the disease. One such team of doctors is this group from Edmonton in Canada, and in 2015 published their analysis of survival outcomes for 14,633 patients with breast cancer. Let us delve in a little more detail into their study. These are survival curves. The y-axis represents the percentage of women still alive, and the x-axis represents the time that has elapsed after breast cancer surgery. It is expected that the curves should slope gently down towards the right side of the chart. More than one survival curve is usually drawn on the same chart to enable us to visually compare the percentage of patients still alive at a point in time after completion of the various types of treatment. Women who underwent breast-conserving surgery, or BCS, with radiotherapy are represented by the dotted blue line, while those who had mastectomy are represented by the unbroken dark line. We see here that for stage 1, 2, and 3 breast cancers, a higher percentage of patients who underwent BCS with radiotherapy are still alive years after treatment compared with those who had mastectomy and breast-conserving surgery without radiotherapy. We can therefore say that women with BCS and radiotherapy had a survival advantage over those who had mastectomy or those without radiotherapy. Please feel free to pause the video if you wish to take a closer look at these survival curves. This is the conclusion that this team of researchers led by Dr. Fisher made. To their knowledge, this was the first study to assess the relationship between type of surgery and survival for early-stage breast cancer patients in a publicly funded healthcare system, and the first to report a survival advantage specifically for stage 3 patients who receive BCS plus radiotherapy rather than mastectomy. Given the consistent results from several large unselected population-based studies in both Canada and the United States favoring BCS plus radiotherapy over mastectomy, they recommend greater efforts be made towards educating and encouraging women to receive BCS plus radiotherapy rather than mastectomy when medically feasible and appropriate. As this is solely an educational video, please consult your surgeon to find out whether BCS with radiotherapy is feasible and appropriate for your specific clinical circumstances. We move from North America to Asia. This is a joint report from 13 institutions in India. These researchers analyzed the treatment outcomes of 9,903 patients and published their results in the Journal of Global Oncology in 2017. Overall 5-year survival rates for breast-conserving surgery, or BCS, for women with stage 2 disease was 94%, while it was 85.8% for patients who had mastectomy. For women with stage 3 disease who underwent breast-conserving surgery, 5-year survival rate was reported to be 87.1%, compared with 69% for those who had mastectomy. The research team concluded that this observational study in the natural setting of care of patients with breast cancer in India showed significantly decreased survival with mastectomy when compared with BCS. From Asia, we move to Europe for our last study in this video. This team of researchers analyzed information from the Cancer Registry of Norway for women with early-stage breast cancer treated between 1998 and 2008. Let's discuss this study a little more. You will recall we had briefly discussed survival curves a little earlier in the video. In this chart, the red lines represent the survival of women who underwent mastectomy, and the blue lines represent those who had breast conservation treatment, or BCT. We can see that 15 years after completion of treatment, a greater proportion of women who underwent BCT were alive when compared with those who had mastectomy. This team of doctors reported that 5-year breast cancer-specific survival for women who underwent BCT was 97% compared with 88% for those who had mastectomy. They concluded that survival was better or equal after BCT than mastectomy in all early stages, surgical subcohorts, and age groups. This is a table summarizing the results of the 3 studies we discussed. As you see, across countries from North America, Asia, and Scandinavia, comparative survival results between breast conservation treatment and mastectomy are similar. For women with stage 1, 2, or 3 breast cancer, better survival or cure rates are reported if they were to undergo breast conservation treatment rather than mastectomy. In summary, therefore, better breast cancer cure rates are observed with breast conservation treatment. In this video, we looked at 3 countries which have reported breast cancer survival data according to the type of surgical treatment that was applied. There are many other countries which have reported treatment outcomes after breast cancer surgery, and we will be unlocking those insights in other videos. If you wish to know whether the country in which you reside has data published on breast cancer surgical treatment, please indicate in the comments below, and we will do our best to respond directly or in the form of a video. If you wish to understand the studies in greater detail, feel free to comment or make a request through the Just Medicine website in the link provided in the description. It is our hope that this information will give women with early breast cancer the confidence to make the right decision for their surgical treatment to help themselves live longer. We will continue to explore countries with doctors committed to seeking out better breast cancer cure rates over several videos. See you in the next one. Cheers!